Hey, it's Dr. Ron Kaiser here. And as we approach another weekend, I think it's time to reflect on some of the words that we use. Cognitive behavioral therapy has taught us that our words precede our feelings. Essentially, our thoughts, as expressed by our words, precede our feelings. And I think it's time to give a little bit of thought to the words that we use. Are we really angry when we might be annoyed? Are we really depressed when we might be unhappy or sad? Things of this nature. We tend to live at a time of extremes, and a lot of times it's very difficult to differentiate the extreme feeling from one that's more intermediary, more intermediate. We know, for example, in medicine that you can have back pain, but that may reflect a herniated disc or a soft tissue injury. Uh, we can have hip pain or need a hip replacement. There's a difference between chest pain and heart attack, uh, but those things need to be evaluated. Now, the good thing about some of the words that we use is that we don't necessarily have to go to an emergency room to get our words evaluated. So, my plea for today is really to encourage you to stop when you feel an extreme emotion, which is, of course, backed by a certain uh, cognitive expression, what you tell yourself and what words you use. I think it's incumbent upon us to ask, is this really anger? Is this really depression? And we may not know, and that's when we may need to get extra help. But a lot of times, if we can tone down the word to express a more intermediate feeling or a lower level feeling, a toned down feeling, um, we may find that the feeling will follow that word. So again, I do think that, for example, for those of you who may have had any connection with anger management, you know that a big part of that is to be able to modify what you tell yourself and to do some alternative behaviors, breathing, and things of this nature. Um, Very often, a loaded word like anger, depression, anxiety, and so on begins to be treated as a condition rather than a reflection of what we tell ourselves. And if we're alert to stopping and asking, what is the word that we're using? And is there an alternative word that more appropriately expresses how we feel? Maybe we can wind up feeling less intense about it and feeling more in control of changes that we can make in our thoughts, in our behaviors, and in the ways that we approach others. Very difficult to have a normal conversation with somebody who you're angry at. It's very difficult to institute certain changes if you feel fragile as opposed to kind of out of sorts or weakened or whatever it may be. Toning down the word can help us to make some changes. When it can't be toned down, that's the time to get help. But you may be surprised at how often you can wind up ultimately feeling better and behaving more productively just by toning down the word. So, on that note, it's Dr. Ron Kaiser wishing you all a good day, good weekend, and stay alert to what you tell yourself.